I see you in the distance.
Twice in 1 week. It's yourself.
Okay, great.
Oh, wonderful. This is just beautiful.
Look at it as how I do it. I stopped
Exactly.
God off.
And it's exactly what.
Oh, yeah, I
Which one? Here in Peoria? It's a great ranch.
Hey, Lieutenant Governor, how are you?
Great to see you.
See you. How you doing?
Good. A little bit hot. you
Yeah,
know, but,
Yeah, it is, but the summertime, you know. Hi,
Hi, I'm Kat Griffith.
nice to see you.
Nice
Thanks
to
for your
see
work
you.
here. Hello.
Hello, I'm Natasha.
Hi, Natasha. Nice to meet you. Thank you for your work and thanks for hosting us.
Sure, absolutely.
Mr. Secretary, how are you?
We want to welcome Governor Rauner and his team for visiting with us today. Human Service Center operates about 7 different facilities, 5 of which offer a continuum of substance abuse services for people who reside in Peoria County and for people who access our service from outside the county. We appreciate the opportunity to be able to share this continuum of services that we do provide. We welcome Governor Rauner to be able to make some comments this afternoon. Governor Rauner.
Thank you. Thanks, Mike. Good afternoon, everyone. Thank you for joining us, members of the media. Healthcare services are essential to the quality of life for the people of Illinois. We're here today to talk about the importance of mental health services in treating the whole person. Mental health is every bit as important and integral to quality of health as physical health, treating cancer or diabetes or any physical ailments. Mental health issues are integral to that. We need the highest quality mental health services we can possibly have. And we in Illinois are making great strides towards treating the whole person, providing high quality mental health treatment along with physical health treatment. This is an important step as we take on many of our challenges, including the opioid epidemic that is hitting hard to so many Illinois families and striking so many families across the entire United States. There have been more than 11,000 opioid-related overdose deaths in Illinois over the last 10 years. That is far, far too many. We have got to keep people safe. We've got to take on this scourge of opioid use. I would like to compliment Mayor Ardis for being a leader in the state and Peoria for taking the challenge on. Peoria area has been particularly hard hit by the opioid epidemic. There have been 44 opioid overdoses here in the Peoria area in the past year, and the mayor is stepping up and really taking the challenge on, and I want to compliment him and his team. We in Illinois have formed a task force. We are now among the leaders in America. We now have a hotline to assist in dealing with opioid use and getting advice and counseling to those who need it. We now have taken on the issue of doctor shopping so that residents in Illinois are no longer going from doctor to doctor to get access to opioids. We are also making naloxone and other related medications available statewide on a free, readily available basis so that if there's an overdose, that can be treated and reversed immediately. And I'm proud to say there were 2,000 opioid overdose reversals in Illinois in the last year. We're saving thousands of lives through the work of our task force to take on the opioid epidemic. And I want to compliment our Lieutenant Governor and her task force and Secretary Demas for his great work in healthcare here in Illinois, taking on this challenge. We have created something we call Better Care Illinois. Better Care Illinois is basically transforming the way mental health services are provided in our state. We got a $2 billion basically restructuring grant for our Medicaid program, $2 billion, so that we can proactively treat mental health challenges, not waiting to the last minute to deal with crises, but proactively help treat the whole person and take on mental health issues early. And treat them, identify them, and treat them proactively so that the patient can be treated and lead a productive life and not have it deteriorate into a situation of crisis and loss of opportunity and quality of life for the people. So we're making great progress. This is an exciting time in Illinois, improving the quality of life for everyone, improving the quality of health care. With that, I'd like to turn the podium over to Lieutenant Governor Sanguinetti to talk a little bit more about the task force and taking on the challenges of opioid use. Lieutenant Governor.
Thank you, Governor. Hello, everyone. It's a pleasure to be with all of you today. Thank you very much for the tour of this facility. Mayor, thank you for being with us. Thank you for what you do here. I'm Evelyn Sanguinetti, and the governor is right. You know, we've been working very hard to overcome this epidemic. When you look at it from the statewide perspective, here in Illinois, since last year alone, we've lost 2,100 individuals to the epidemic. And when you put that in comparison to other deaths, simply put, the opioid epidemic has taken more lives than those lives that are taken in car accidents, more lives than those lives that are taken through breast cancer. So this is significant. And I thank the governor for having been proactive since day one to do something about this epidemic. We could sit back and do nothing, right? Because we talk about not having any money, or we could be proactive about it. And that's what Governor Bruce Rauner has done. Since day one, over a year and a half ago, he signed an executive order so that we could create a task force. And from then, as a task force, we hit the ground running by traveling the state and finding out how different communities were dealing with this epidemic. We heard many stories. A lot of it depended on resources. A lot of it depended on stigma. But the fact is, right now, we have moved the needle significantly, and we will continue to do that. A lot of people say you're government, and it's great to have a task force, and it's great to have an executive order, and it's wonderful to have a plan. But what have you done? And I have to say that we've done a lot. As you heard, last December we unveiled our 1-800 number, and it is 1-833-2-FIND-HELP. Not only that, but we also have Narcan, or naloxone, that resuscitator that we keep hearing about. Those experiencing an overdose could be revived by Narcan. Now those wanting Narcan could go to your local CVS, to your local Walgreens or whatnot, to be able to become first responders as a community, and that's been significant. Now, through our helpline, I have to say that we've helped more than 4,000 people who have been impacted by opioid use. And today, we're very proud to also say that we're unveiling another component to our helpline, and it is our online component, www.helpinillinois.org. Again, www.helplinil.org. Since Governor signed Senate Bill 772 into law in December, that also requires physicians to go in, and it's mandatory for them right now to tell us how many opioids they're prescribing. And this is significant because you keep on hearing those stories about doctor shopping. But because of this initiative and because of the Senate bill, this is really being curtailed to date. Finally, I have to say that Secretary Demos is going to tell us a lot of stories about how we're also attacking the whole problem, the individual as a whole, and this is going to be significant as we go forward, because we all know that substance use disorder, the epidemic, it simply knows no color, no community, no class. It's an equal opportunity aggressor. And the only way we could attack this aggressor, this epidemic, is by working together as a community to make this a thing of the past. Secretary Demas, the floor is yours.
Thank you, Lieutenant Governor. Thank you, Governor, Mr. Mayor. Mike, thank you for hosting us. No one starts out using opioids because they want to become addicted. No one wants this for their life. No one wants to wake up in the morning worried about where they're going to find the medication to help control their cravings, to keep them in balance, to dull their pain. No one wants to put their lives or their family's lives at risk No one chooses to have this disease. But opioid use disorder is a chronic disease like any other chronic disease, like hypertension, like diabetes. It starts with a combination of genetic predisposition, and then environmental triggers can lead to behaviors that exacerbate the problem. And then it becomes a chronic condition that needs treatment. It changes the way the brain functions, which can lead to tolerance and cravings and compulsive and destructive behaviors that have created in our state a public health crisis. Even though we understand that addiction is a disease, for the most part, we still don't treat it like a disease. Stigma creates fear that seeking help will result in somebody being ostracized by their family or friends. Stigma makes parents of children with substance use disorders afraid that they'll be judged as failures, afraid that their children will be judged as bad kids or morally weak. The fear and shame of coming forward has very real negative consequences for people's chances of recovery. In fact, Governor Rauner recently signed legislation or approved an initiative, it didn't require legislation, that allowed us to change the name of our Division of Alcoholism and Substance Abuse, which for decades has been known as DASA, to the Division of Substance Use Recovery and Prevention, to purge the notion of substance abuse and the label of substance abusers from our vocabulary, because that's a hurtful characterization and it's stigmatizing. Stigma is a part of the reason people don't get the treatment they need, but it's only part of the reason. The other thing that prevents people from receiving the treatment they need is the services available in communities. For that reason, DHS is working hard to increase the availability of substance use disorder treatment resources. We received, for the second year in a row this year, an additional $16 million in federal funding to treat substance use disorders. And I'm very pleased to say that I had the privilege earlier today of letting the governor know, we heard last night, that that federal award is going to increase to $28.5 million for each of the next 2 years, which is going to improve our ability to provide the kind of treatment that's needed in our state. Last month, also, as the governor and lieutenant governor mentioned, we were approved for what's called a Section 1115 waiver from the federal government that will allow us to provide services with Medicaid reimbursement that previously Medicaid would not cover. And so we're using that to develop 10 pilots around the state, 4 of which focus exclusively on substance use disorders, that will help us intervene with whole person care rather than dealing with this problem in a fragmentary way. We call our 1115 waiver Better Care Illinois. It's going to expand coverage for withdrawal management services, for peer recovery support services, which is a fancy way of saying, we find people with lived experience that have dealt with this issue themselves, and we enlist them to counsel people that are, still dealing with this issue. And that is one of the ways that we help people come to grips with their need for treatment in a way that feels good to them. It's also going to enable us to expand our residential treatment services and our case management services. Our expectation is that this is going to make a big difference, not just in our ability to provide an integrated behavioral and physical health system in Illinois, but specifically to intervene in the opioid crisis. And speaking of intervening in the opioid crisis, I mean, we have been, as Lieutenant Governor Sanguinetti suggested, pretty successful, even in difficult financial circumstances, as you all know that we have, of expanding the availability of treatment. When Governor Rauner took office, there were 59 outpatient methadone programs in Illinois. We now have 84 programs. When Governor Rauner took office, we had the ability to treat about 8,000 people per year in methadone programs. This year, we project that that number will be 12,000. And this increase in federal funding we found out about last night will continue that trend. The other thing that we've done that, as Lieutenant Governor Sanguinetti referenced, is launch the Illinois Helpline, which we can't say it enough times. That number is 1-833-2-FIND-HELP. That's for the telephonic version of it. And today we're launching the web-based companion to that, that is Illinois, or is it Helpline, I'm sorry, let me start again. HelplineIL.org. We've already received, as Evelyn said, 4,000 calls. The other companion to this is we have a social media campaign going on that we call Ending Opioid Misuse, #EOM. We received a really helpful donation. I just want to say that DHS and its sister agencies are moving forward aggressively to implement the state opioid action, helping us begin the long journey toward successfully preventing opioid. It's received over 18 million hits so far, 18 million. Agencies under the governor's leadership will continue to work to meet the goals of the state's action plan and to change
the leadership here at the Human Services Center here in Peoria. This is a national leader in treating the whole person with outstanding mental health services and addiction treatment services, along with primary care services. This is a role model and an inspiration. That's why we're here. We want to use many of the protocols and processes that are used here at the Human Services Center in Peoria. We want these to be expanded around the state and used to treat the whole person and proactively treat mental health as part of treating the whole person and their physical health, as well as mental health. The leader, one of the leaders here is a very talented individual, Dr. Pinto. I was told that he is retiring after many years of wonderful service here at the Human Services Center. And I did write a letter on behalf of the people of Illinois. Dr. Pinto, if you could come up. I want to present you with a letter of appreciation for your pioneering work in substance use treatment as well as mental health treatment. And on behalf of the people of Illinois, thank you for your services and best wishes in your future endeavors.
Thank you, Governor.
Okay, we can open up questions from the press or anybody else who's here. Yes, sir.
You mentioned the prescription
Monitoring. Yep.
Is there any I mean, well, I know that a pharmacist or a doc can look at that. Is there any way that a person can look at that? Because that way they can also see which docs are shopping things, and it's not just a one-way thing, it's a two-way street. Is there any talk of opening that up?
You want to talk about that?
Not at this point, just because of medical confidentiality.
But there's a way that you could do it for the doc not to have the names of the paid patients. You could still see which docs are
Oh, I see what you're saying. Oh, to focus on making that information publicly available. That's something that we can take under consideration. That would drive big changes in behavior, I'm confident, when the federal government started publicizing information about C-section rates. The rate of C-sections in this country, plummeted. And so, I mean, that's something that we could look at. We haven't discussed that to this point, but.
And also what I'd like to know is, you guys mentioned this better care. You're trying to make more money out there. Is there any talk about trying to mandate, at least on a state level, for private insurance to be able to cover some of these treatment options, either medically assisted or non-medical?
We now, parity is the law of the land. And so insurance companies in Illinois and other states are now required to cover behavioral health services the same way they cover physical health services. And that's a recent change in the last year and a half or so, but it's a big change. People are still learning what their responsibility is under that new law, but that does exist.
Mr. Secretary, could you tell us about the 10 pilots that are being developed around the state? And what does this mean for Central Illinois? We hear so often there are not enough treatment facilities in this part of the state, or the state in Peoria.
Yeah. Well, I think one of the thing that will probably make the biggest difference in that is the fact that as part of our 1115 waiver, we're being exempted from what's called the IMD exclusion, which prevents residential treatment services from being reimbursed by Medicaid if they have over 16 beds. And so now, while we're in this crisis, we're going to be allowed to trigger Medicaid reimbursement for people that are Medicaid eligible that are receiving that kind of residential treatment. So that'll probably make the biggest difference here in Central Illinois.
Now, does that mean, what does that do for the ability to cover more beds? Or, I mean, does that address the problem?
It should. I mean, yeah, it's.
Not enough treatment facilities?
It should enable them to do that. We were speaking with that earlier with Mike Kennedy. It's not a one-to-one thing. This isn't dollars for beds, but as people are able to get about 50% reimbursement for Medicaid for these services, it will free up money that they're now, investing, so that we do hope and expect that they will be able to expand capacity.
It's not the pilot program. Is that part of the pilot?
Yes.
Okay.
Yeah, that's actually, it's going to be statewide, though.
Okay. We've heard a lot. I just wanted to follow up.
On to that problem, I would have to refer you to Dr. Nirav Shah for more specifics on that.
Yeah, you're asking a very important question. The answer is our administration is very strongly taking action against this dramatic increase in K2 and as the euphemism SPICE. And I can put you in touch we can get you with Dr. Nirav Shah and some of our other leaders to talk in detail about what we're doing.
As far as for the task force, you have been here, you've been all over the state. Are we ever going to see a final report on that? And if it's come out, where can we find it? Because I've missed it.
Great question, and I do remember we talked a few months back. So there was the executive order, of course, there was the plan, and now we're looking to implement that plan. We're implementing that plan over, I believe, the next 2 months. There was a task force, and we also worked alongside a lot of stakeholders throughout the entire state of Illinois. They took a look at our plan, and they gave us ideas as to how to implement that plan. We are taking all of those ideas, implementing them shortly, and I think those ideas should be out over the next 2 months. But as a task force, you folks know that we've been in and out conducting field hearings, roundtables, visiting all sites to find out how Illinois, all the communities were responding. So you're going to be very happy with those results. Also, you're going to continue to see growth, not only the website that we have now and the 1-800 number and the standing order and everything that we have by virtue of the 1115 waiver, but you could anticipate a lot of growth coming from that other steps, because there's recovery. Everybody that's in recovery will tell you a different story as to how they got here today. And so we need to have a lot of mechanisms available so that people could meet us where they're at.
Why did you decide to come here today?
Yeah, because this Human Services Center, where we are, is part of a network of 7 facilities. This is a role model. They do an outstanding job of treating the whole person, and they're leaders in treating mental health issues, substance use issues, as well as physical health. And we would like to use them as a role model, and that's why we're here, to say thank you to them. and to get the word statewide through members of the media of the action we're taking to improve mental health treatment, improve substance use treatment, and both take on the opioid scourge. We saved 2,000 lives through quick response of treating those who had been overdosed in the last year. We want to cut overdose deaths in the state by a third here in the next year or so, and we're making progress. We want people to know that. We want to make everyone aware of the importance of working back against the opioid crisis in the state. We also want everyone in the state to know that here in Peoria and in many of our communities, we are now national leaders in proactively addressing mental health and treating the whole person as part of an entire healthcare system. We think we're going to have some of the best mental health treatment in America over the next few years with the $2 billion we got from the federal government to restructure our Medicaid program, very focused on proactively treating mental health.
Thanks, you guys.
Thanks very much.
Thank you very much. Appreciate it.